There are two studies that are going to be present at ASH this year looking at the efficacy of Venetoclax in multiple myeloma. So both are being done in patients with relapsed disease. So there's one study that is looking at Venetoclax alone, and 66 patients were enrolled on the phase 1 study. We found what is the maximum tolerated dose in that study, and we saw a 21% response rate overall in the relapsed patient population. And this was a fairly advanced patient population with about a median of 5 lines of therapy. And when you looked at the 11-14 translocation carrying patients, which was about 30 out of the 66, the overall response rate was about 40%. So this is something that we typically don't see in such a heavily pre-treated patient population. And this also included some patients with very deep responses. And the median progression-free survival was almost 12 months in this cohort of patients with relapsed myeloma. And some additional molecular tests that have been done within this 11-14 patients have helped us identify the group of patients that are most likely to respond, what we call a BCL2 to BCL-XL ratio using gene expression. And that actually tells you or identifies a group within which there's about an 85% response rate for the single agent Venetoclax. And that is quite striking given what we have seen with other drugs in terms of single agent activity in a relapsed myeloma patient.